Hi everyone, I'm Dr Becky Appleton, and in this video in the series I'm going to be talking to you about doing quantitative research. Quantitative research refers to research which gathers numerical information and uses some form of statistical analysis to understand the phenomenon of interest. It is used to find patterns in data, explore how different variables can relate to particular outcomes, or the relationships between different variables. Quantitative research can also be used to make predictions or test assumptions. And quantitative research can be conducted alone as a standalone study or as part of mixed methods research, which involves combining quantitative and qualitative methods. Here are some examples of some good quantitative research questions. So, firstly, what is the prevalence of undiagnosed type 2 diabetes among adults aged 40 to 65 in urban primary care settings in England? Secondly, what socio-demographic or clinical characteristics are associated with lower quality of life amongst women with breast cancer? Or a final example, does a digital cognitive behavioural therapy intervention improve depressive symptoms more effectively than standard care among adolescents referred to CAMS? You can see that these are all quite different questions in how they're worded, but they all share some common characteristics. They all specify their study population, so this is something that's really important when thinking about quantitative research specifically, is that you need to define who you're studying in a measurable way. For example, in the first question, we can see this would be adults aged 40 to 65 registered to urban primary care settings. In the third example, this would be adolescents referred to CAMS, and you would often then go on to define the age range you're using for adolescents. These generally also include the dependent variable and the independent variable, so the thing you're measuring and the variable that you're changing. So, for example, in the first research question, the dependent variable is type 2 diabetes, or in the third research question, the independent variable is a digital cognitive behavioural therapy intervention. In this third example, the dependent variable, so the thing you're measuring, would be depressive symptoms. Here are some examples of different quantitative methods that are commonly used in research. The first is surveys, which are generally undertaken to understand people's views and often use multiple choice questions or fixed response options. Next are observational or cohort studies, where you might follow up a group of patients over time. You can also use routinely collected data for these kind of studies. For example, a retrospective cohort study would use a sample of patient data which has already been collected, for example, over the past decade. A randomized control trial is often referred to as the gold standard method to test whether an intervention is effective. Participants are randomly allocated to either the treatment or the control group. And the idea is that people in each group will be as similar as possible due to this randomization. And this means that any differences after a specified follow-up period are likely to be due to the effect of the intervention, rather than any other random factors. And finally, a meta-analysis, which is a method of data synthesis which is used in systematic reviews. And this is where you pool findings from several different studies to come up with an overall effect size. The advantage of this method is that you end up with a much larger sample than just taking into consideration the findings from one study alone. So meta-analyses are really useful if you want to find more certain evidence about a topic of interest. I'm now going to provide an overview of things to consider when analysing quantitative data. For almost all quantitative studies, the first step is doing some descriptive statistics. So, for example, this could be using statistics like finding the mean, median, or range of your data points. You would also commonly describe your sample, so the proportions of participants who fell into certain socio-demographic groups, for example. If you were just doing a survey, this might be enough. However, if you're doing some more in-depth research or you're testing a hypothesis, you would then go on and do some further statistical testing. T-tests are a commonly used method to compare the means of two groups, whilst an ANOVA test is used to compare the means of 3 or more groups. A one-tailed t-test means that you are checking for a significant difference only in one specific direction, whereas a two-tailed t-test checks for a significant difference in either direction, so essentially you're just looking for a change rather than predicting whether that change will result in scores going higher or lower on a test, for example. If you were doing a type of study where you want to explore which variables have an impact on a particular outcome, so for example, whether certain groups have better outcomes following cancer treatment, then you would do something called a regression analysis. And this is where you can put pre-specified variables into a model, and this allows you to see whether certain groups receive better outcomes than others. There are different types of regression analysis. If you have a binary outcome, so received treatment yes or no, then you would do a logistic regression. However, if you have continuous data, such as scores on a test, then you might do a linear or multiple regression instead. And if your data is hierarchical or clustered, so for example, you could cluster patients by particular GP practices or by particular mental health services that they attend, which is quite common. You think that there might be some similarities that these participants share, that there might be different from other groups within your study, then you can control for these differences using multi-level modelling or multiple regression. In terms of software for doing this type of analysis, something like Excel is really useful for simple descriptive analyses and presenting charts. However, if you're going on to test a hypothesis or do more complex statistical analysis and modelling, then software programs such as SPSS, Stata, or R are much more commonly used. It is important to specify your analytic approach before you start your analysis in order to avoid bias. An example of this is p-hacking, where you conduct multiple tests until you find a significant result. Being open and publishing your analytic approach also means that others can check your analysis. They could perhaps try and replicate it in their own study. Academic journals are now often requiring the statistical analysis plan to be published online in advance, and also for you to make your data and analytic code available to allow others to replicate and check your results. I mentioned p-hacking a minute ago, and this is one caution to be aware of, and this is the impacts of multiple testing. This can create a form of statistical bias. So if you conduct multiple tests on the same data, this increases the likelihood that one of these tests will give a statistically significant result. This is known as a type 1 error or a false positive result. There are a range of statistical methods you can use to mitigate the impacts of multiple testing. One of the most common being the Bonferroni correction, and I'll show an example of that on the next slide. I'm now going to provide an overview of how to interpret quantitative research findings. Something which is commonly shown in results sections of papers is a p-value, and this shows how likely is this result to have occurred by chance. It's normally set as p is 0.05 as shown on the slide here, or sometimes 0.01. Generally, the rule of thumb is that if the p-value is less than 0.05, then evidence against there being no effect is fairly strong, so we can reject the null hypothesis and conclude that there was a positive impact, for example, of an intervention. Just another example. So say if a new drug has been studied and it's been found to reduce blood pressure by 5 milligrams of mercury and the p-value equals 0.03. This means there's a 3% probability that we'd see this number by chance alone if the drug truly had no effect. If you were adjusting for multiple testing using the Bonferroni correction I mentioned on the previous slide, you can simply do this by dividing the p-value by the number of tests conducted. So, for example, in this case, if you were doing 10 different tests on the same data, then the p-value for each test would need to be lower than 0.005 for each result to be considered statistically significant. Moving on to confidence intervals, and it's normally the 95% confidence interval, which is normally shortened to CI, which you see presented in results sections of research papers. A 95% confidence interval means that if we repeated the study many times, the true value would fall inside this range in about 95% of studies. If your confidence interval is narrow, then it means that you can be more precise. If you have a wide confidence interval, then there's perhaps more uncertainty in your findings. Another example, so you have a drug which reduces blood pressure by 5 milligrams of mercury. The 95% confidence interval is 2 to 8. This means that the plausible true effect is somewhere between 2 and 8 milligrams of mercury. You can also look at confidence intervals to see whether you've got a statistically significant finding from your study. If the confidence interval does not cross the no effect line, which is normally set at 0, then this means your results are statistically significant. Whereas if the confidence intervals did span 0, for example, -1 to +3, then this means that your findings were not statistically significant. And the final term I'm going to explain today are odds ratios. And this is defined by the ratio of the odds of an outcome in one group versus another. So for example, if you have an odds ratio of 2, this means that the outcome has been twice as likely. Or if an odds ratio is 0.5, this means the outcome is half as likely. An example of this is commonly seen if you look at a particular outcome after receiving treatment between a control and an intervention group. This has been quite a whistle-stop tour of quantitative methods. So I do urge you to go and find out more about any of these particular statistical tests if you want to go on and do this type of research yourself. In terms of the advantages of these methods, they're useful to find out what interventions or treatments work, how effective they are, and for which groups of patients. Quantitative methods are generally more objective and less likely to be affected by researcher biases than qualitative research methods. However, they don't necessarily answer the question of why things are happening. For example, why the take-up of an intervention is low. And this is where qualitative research can come in and could potentially be rectified by doing a mixed method study. So for example, if you're trialling a new intervention, you have your quantitative analysis looking at its effectiveness, but also a concurrent qualitative study, which allows you to explore things like the implementation of this new treatment. Another con of quantitative methods is that you often need to recruit a larger number of participants, especially if you want to test a hypothesis. It can also lack the ability to go into more depth on a particular topic. And again, this is why mixed methods research can be really helpful. So you have the depth from quantitative knowledge, but then also that breadth from your quantitative research component. And finally, here are a couple of useful resources that I recommend reading if you want to go ahead and do your own quantitative research. This first reference goes through how to conduct a quantitative research study step by step, from framing your research questions to publishing your results. And the second reference provides a useful overview of statistical methods that are commonly used in medical research. That's it from this video, but you can see the direct link on screen to the catalogue hosted on NHS's Learning Hub platform. Registration is free, and if you have an NHS email, you'll have free access to both the Learning Hub as a whole and the WE-R NHS catalogue resources. We have links to podcasts, videos, and journal articles on a range of topics related to education and workforce research. WE-R NHS is on YouTube, and we also have a regular e-newsletter. Thanks very much for watching.